On PM Express tonight, our continuous conversation of the global pandemic that is eroding a lot of countries, the coronavirus pandemic, and also looking at frontline workers, how to protect them. Tonight, we're making a case for journalists, and you may have known, and in Ghana here, of course, our confirmed COVID-19 case count now stands at 287. The death toll still stands at 5. 4 more regions apart from Accra and Kumasi have recorded cases, and we are waiting results of over 15,000 tests. The president made the announcement on Sunday and said that the results of that over 15,000 tests will determine whether to review our lockdown or not. Now, let's move on to so many concerns that have come up, but you also know that the breakdown of the regions, Accra continued to lead the league with 256 cases, followed by the Ashanti region with 18 cases, Northern region 10, Upper West region 1, Eastern region 1, and Upper East region, which is the latest in the COVID-19 recorded cases. The president says this week is critical after more than 19,000 tests. And out of this 19,000 tests, we're going to be getting results for the 15,000 that have been tested. So the results will determine what next for Ghana. There are already concerns for a nationwide lockdown after other regions apart from Accra and Kumasi recorded cases. And you may have heard from the Ghana Medical Association and other people, even outside Ghana, advocating that there is no debate about this, that whether we should go for a nationwide lockdown or not. It is something that we must do. And I'm recalling a health expert saying that when we don't overreact, we may be too late in responding to the COVID-19 outbreak. Now, leader of Ghana's coronavirus today is assuring us he's a leader of the test team, and he's allaying fears of the country hitting the thousands or the figures that have been seen in Europe and the US. He says we won't get there, but he puts a caveat there. He says if we continue to do the things that we are doing, we will not hit the thousands. We will not be like the other countries, the US and Europe. And so we need to watch out whether we're doing the right things, whether we are continuing with the right things that we've been asked to do. Our biggest worry as a country, though, has been the safety of frontline workers. Frontline workers continue to call for more PPEs. In the last few days, we've had calls from Kolebu, from Rage, Komfanochi Teaching Hospital, all calling for personal protective equipment to aid them to work because they need to also stay alive. We're being assured by the president on Sunday that they've brought in some more PPEs. Yesterday, the GMA said they've been supplied with some PPEs, but there is never enough for the PPEs. As we fight this pandemic, we need to always stock PPEs because that is what the front health liners need to fight the coronavirus. The president has also gone ahead to announce some 50% salary increments for frontline health workers. That comes as good news, and the health professionals are receiving it, are embracing it, and he's also assured of more PPEs for them whilst at work. This also sounds good because it will actually aid them to do more. But information has also become an essential tool in the battle against COVID-19. Without information, we can't know what is going on in the world, what is going on in the country, and even educating the people on how to stay safe. Information has become very essential. Journalists in Ghana and across the world are at the front lines of gathering and disseminating life-saving information, and you've seen that. If you've been watching JoyNews, you've seen that we've been updating you, we've been giving you a lot of information on how to stay safe. Now, one of the frontline workers that we seem to be forgetting is journalists who go all out to get information for the public, even during a lockdown. So most of you are at home because there's a lockdown, and you are looking forward to getting daily updates. How do you get that? If journalists are at home and also observing the lockdown, you certainly won't get that information. But should the journalist be considered a frontline worker in these times of crisis? It's one question we'll be looking at. I have all the people who have the answers. We'll be focusing much on that. How safe is the journalist during this COVID-19 period? And that is also a very important conversation that we may be losing sight of. What extra precautionary measures should the journalist take whilst at work? Is something we'll also be looking at on PM Express tonight. So the question tonight, how do we protect journalists as the fight against COVID-19 continues? I have all the people who can provide you the answers. Please stay with us. And we're live on PM Express. My name is Aisha Ibrahim. In the studio with me is Fred Smith, who is head of our health desk. And you've seen him more of the time since COVID-19 broke out. Joining me also via Skype is Suleimana Brima, who is executive director of the Media Foundation for West Africa. He's joining us via Skype. Afel Moni is also president of the Ghana Journalists Association. Thank you so much for joining us. And Ken Ashigbe, CEO of the Ghana Chamber of Telecommunications, he's also will be joining us via Skype. And also Dr. John Amoesi, who is a lecturer, Global Health Department of the KNUST and leader, Global Health and Infectious Disease Research, KCCR, will also be joining us from the Ashanti region, Kumasi, via Skype. Thank you so much, gentlemen, for joining me. And let me go straight to you, Suleimana Brima, and find out from you quickly, what's your assessment of our coverage of the COVID-19 pandemic so far?
Well, it's critical time. I think no one was prepared for this situation that we are in. I doubt media organizations have prepared themselves to do emergency reporting. And under the circumstances, we had to mobilize ourselves with the few logistics that are available to ensure that we give the people the best that we can. And so far, I think that it's been good. We are not in the situation of media houses in advanced countries where logistics are easily available. Arrangements can quickly be made in terms of security and safety issues. And given that we have all these challenges and yet we are able to serve the populace with the necessary information, I think that I would say the media has so far done so well.
Well, I'd like to bring in Ken Ashigbe here. Definitely, you've been monitoring how our coverage has been. Have you noticed any shortfall in our coverage? Have we been comprehensive? Have we been useful, for instance, in the fight against COVID-19 pandemic?
I think that to sum this up, I heard that of the newly appointed Deputy Health Minister designate. He mentioned that in a particular class that they had, he asked the most important person was in a pandemic situation, and people gave various answers, including chants and all of that. I said that communication person that was important. I definitely believe that in crisis times like this, information is even more important than the issues of medications, especially for a pandemic that you really do not have a treatment. The right at the right time is really critical, and I think the media so far has done very well. The challenge you have is the polarization of media, social media is competing with traditional media, and there's a lot of fake news out there. And find out that traditional media has tried to churn out information, and I think generally I side with when he says that we've done a good job. There's a lot more to do. I definitely in a situation like so far done quite a good job.
Well, I think that in this conversation, I mean, one of the biggest questions we've been asking as journalists is whether to take an advocacy position in reporting on COVID-19 or be strictly impartial in doing our jobs. By this, we're just reporting it as it is without attaching any feelings, attaching any passion and what have you. But let me bring in Afel Money on this one. In your estimation, do you think that journalists have been adequately protected?
Aisha, a few weeks ago, nobody dreamed that we're going to be convulsed by this magnitude of challenge we are facing now. So it came as an earth-shattering shock. But our response has been instinctive, our coverage has been intensive, and to side with Sule and Ken, highly impressive. It said that in every human institution, perfection is an impossible goal. So in certain sections of the media, there are instances of imperfections. But these imperfections do not obscure the fact that the media have done so well, and they need to be applauded so high.
Well said. But COVID-19, as the name suggests, is actually not a friendly name to the media fraternity. This is more scientific. And the reason why I'll be bringing in Dr. John Amoisi shortly, let me come to you, Fred. You're the head of our health desk. There's been so much pressure on you to scoop information for us to give to our viewers who need it to survive. How has it been out there?
Well, Aisha, thank you. It's been very difficult, but also rewarding if you finally get the information you want. A lot of people don't want to hand the information to you. There are some who want to volunteer the information. A lot also don't want to give you the information, and that has been the challenge. For instance, we know on record that Ghana recorded our first case on the 12th of March. That's when we were told. But in actual fact, we recorded our first case on the 5th of March. It means that our authorities get to know about the situation and don't tell us for several days. And it is the job of the journalists. I think the point they make is that they don't want to cause fear and panic in the system. And so that's how come they manage how they give the information to. But whatever you do, you still give out the information. Okay. And so why don't you just give it out? The media is in a position where they will report once they get hold of that information. And so that has been the little challenge between the media and those managing the situation. And you know, there are a lot of workers who think that this information must be out there so that people can make the right choices, take the right steps to protect themselves. If we've recorded a case and it is Kwame Mensah, let's all know that this person has got it, and so all of us take precaution. We don't get too close to the person. We take extra precaution on that. That's been generally the challenge.
And of course, that has brought about the argument of whether the journalist should take an advocacy position or just be strictly impartial about what we do and report it as it is. And that's why I'm bringing in Suleiman Abrahima once again. And the question is, what position should we take? Should we take the advocacy position, or we should just go strictly impartial as journalists and do our job?
I think that is a very, very dicey situation, and we need to be guided properly. We would reckon that even as a country.
Okay, we lost Suleiman Abrahima there. We'll try and get him back to respond to that. And this is the time I want to bring in Dr. John Amoisi, who is a researcher himself and a specialist in infectious diseases. Now, COVID-19 is a scientific health-related global story. And I mean, you hear COVID-19, you hear coronavirus. It's so technical. Mostly virologists, scientists, doctors are the ones who better understand this topic. How does the journalist cover such a story while still remaining accurate?
No, thank you very much for your question, Aisha, and a good evening to your listeners. No, thank you very much, Aisha. Once again, it's always a pleasure. I think it's really important for journalists to recognize the role that they play here, because journalists become the health workers at the front, those of our researchers and scientists, and the public would, be fed with information. Today, there are many sources of information. Your print, electronic media, different languages from all over the place. And I think that we need to recognize that this COVID-19 is a disease that beyond human clinical disease to what I'll describe as a societal disease. And when I say a societal disease, what is that the impact or the repercussions of this disease, which will affect somebody's body, go significantly beyond an illness, and in actual fact would go even significantly beyond the illness in a singular individual. Now, for this reason, it is important that we are able to bridge the gap between the science and the medicine and the people who will need to be involved in ensuring that the disease doesn't spread any further. Now, to buttress my point, if I have some time, I would like to show you the Google Community Mobility Report on Ghana, which was released on March 29. I don't know if you've had the opportunity to see that, and if I can perhaps just share my screen with you to see this. I think that would be very helpful. Just want to do a screen share so that you can see. I don't know if it's visible to you right now, but you would see here the mobility changes in Ghana for retail and recreation, changing by about 15%, significantly decreased since the outbreak. Pharmacy and grocery, you realize, is gone up by 8%. Use of parks and other places, whatever these are here in Ghana, have gone down. Transit stations, workplaces, and then the residential. Now, all I'm trying to do here is to show you how important it is to recognize that this disease is something that goes beyond something that is clinical, and therefore the need for people like journalists to be at the forefront of interacting with the
Well, this is technology for you. We'll try and get Dr. Amoisi also back on the line. But if Kenna Shigbe is still on Skype, I just want to give that question back to you. As journalists, we're found between trying to do some advocacy and also trying to say it as it is. Where do we stand? I mean, which position should we take? Report it without any emotions, without any feelings, or just go straight? Or just attach some feelings and massage it a little because people will feel bad about it?
Well, I think Aisha, so there's a very fine line that we need to walk in this particular situation. In as much as we would want to report, especially when you have your news to do, report the facts the way they are. We also need to realize the fact that as we speak now, we are part of the risk communication and the social communication. So we need to have that at the back of our mind when we're reporting. We need to realize the fact that the issues of panic and the decisions people take when they're in a panic mode also tend to affect decisions that people would do and things that people would do that might have implications for all of us as a society. So we, the journalists ourselves, we also need to be advised informed in terms of the information put out, and our access maybe also come. So the thing about wanting to report a daily of people who are patient, when you are caught up in a situation where marginalization is also happening, we need to be very sensitive about things like that. So the role we have to play will be a dual. Definitely the facts would have to be given out, that we can't have the truth would have to be true. But we also need to be measured in terms of what it's not just an issue of being the first to come. That's not just what should be the major what we think. But how do we also mobilize society to be able to ensure that this pandemic facing us, which is just clinical, as Aboishi said, and also has a lot of human socialization concept part of it. And we need to be able to manage that. We need to be able to serve information to people. We need to play those roles because there's a lot of mobilizing society to act the way they ought to act. And that role has to be played as much as we inform. We also need to educate. And in educating, a bit of advocacy have to come in there. The situations that, there's a drop and have voices of people to tell their stories. All of that has to happen. We need to be able to support the frontline who are in the middle of it. How do we support them in terms of the work that they are doing? How do we also mobilize the country so that we all act together, as a united against this disease that confronts us? So all of these are considerations that the journalists would have to play. So in as much as the journalists do that, the publishers, the owners of media also have a big role to play in ensuring that these people who are at the very front line and journalists at the front line are also protected to also work on their psyche, because some of the things, if it impacts on them, could impact on what it is that we do. So,
very interesting perspectives being shared by Kenashigbi there. You know that he's a guru when it comes to media work. But Athol Money is also on the other line. And based on what Kenashigbi had just said, and also drawing from what Fred, the experience that Fred shared with us, the fact that information managers want to manage information because they don't want to create fear and panic vis-a-vis our viewers, our listeners, those who read our newspapers, who are hungry for information, to be informed, to be able to take precautions. What do you do in times like this as a journalist?
I think the contextual factors and the situation variables should determine what you should do. The point has often been articulated, and it bears repeating that we are not in normal times. But what confronts us calls for the highest display of professionalism on the part of all journalists. And Landers teaches us that the naked truth is better than a well-dressed lie. And the naked truth is that journalists do not know it all. There are times where we have displayed our ignorance, crass ignorance over issues, and tend to portray unknown pretensions. And the truth is, we do not know it all. So this is the time for us to cede the space, media space, for the experts, and not to seize the same space to peddle our ignorance or to display our lack of knowledge about what's happening.
So in essence, we must always wait for the information managers before we release information.
Certainly, yes. As I did, certainly, yes. We are not in normal times. If under normal circumstances, the tendency would be to scoop each other. Now we are not racing against anybody. We have joined forces to fight a common enemy, COVID-19. So this is the time for us to allow the experts to speak more. This is the time to tilt our stories in certain angles to score political points. This is the time to twist the truth. This is the time to put a spin on any issue. So this is the time for us to disseminate facts about COVID-19 from the experts, whilst doing our functions, natural functions as educators. The Bible, which is a perennial spring of wisdom, teaches us that if a blind man leads a blind man, most will fall into a ditch. That's the reason why the point that Dr. Amoesi was making is very, very valid. The fact that, I mean, it's a technical thing. It's not familiar to journalists. It's actually the scientists, the virologists, those who work in the lab, the doctors, the nurses who really understand this. They better understand it, and that's why we should involve them. So how do we stay relevant? Dr. Amoesi, you were making some interesting points there before your line dropped.
No, thank you very much for that, Ashton. Sorry for the technical challenges. The journalists will always be highly relevant because they are an important interface between the official mouthpieces of the government and the people. Because more often than not, people would listen to what's happening in the news. They'll listen to what is being put out on in the newspaper. They would read the posts that come out on Facebook. So beyond the journalists interfacing with us, the doctors, the researchers, and others, it's also very important that the journalists try and also bring in order to remain relevant to your question, additional people in society who can speak to the issues and who can transport their message. Because what will happen is that you, the journalists, will interface with us, the medical doctors and the researchers, because here I wear both hats, and we will give you the information. Now, there's a whole group of people who also listen to beyond you, the journalists, which is our celebrities, our religious leaders, our sports personalities. And it's really important that the journalist is also able to package this, present it to these individuals so that they can also represent it to their audience, whom they contact on Facebook, on Twitter, and via various other platforms. So I think for the journalists to remain relevant, it's really to recognize these additional interfaces and be able to transport that message from the scientists and from the doctors, put it in a way that can be digested by the general public and engage with these others that have been mentioned.
Let me bring you in, Fred Smith, once more, because you've been interacting with people, you've been having interviews with people. One of the serious issues we've have to deal with is the asymptomatic people who do not show signs, who are not down with any fever. They're walking about, they're carrying the virus, but there's nothing to show for. Do you feel safe as a journalist going out there, getting information from people to be able to serve your viewers?
Well, I think the WHO, the Ghana Health Service, and the Ministry of Health have given us guidelines as to how to prevent a spread of the disease. One of them being, leaving a space between you and the person you are interacting with, whether they are showing symptoms or not. You're still in these times, we're not in normal times, you need to give the space. If you observe someone who is sneezing, coughing, those are symptoms. You don't have to get close. You need to wash your hands regularly, and under running water, you need to use the face masks and to ensure that you are not if you have it, you are not spreading it, or someone you're interacting with has got it, that person is not spreading to you. That's the only way we can stop it. And once you understand this principle, you are able to protect yourself and protect those you interact with as well. So I feel very safe, because anytime I've had to interview people, I've had to have some close interaction with someone, I use one of these protections, or more than one of them, to ensure that I am safe and I'm not returning to my office with any virus that I may have, picked up outside. So yeah, the safety bit is there once you follow the principles as have been told.
Now, we all agree that we are not in normal times, but one thing for sure, information is very necessary during this time. Information is key as we fight the pandemic. And based on what Dr. John Amoesi has just enumerated, the question I want to pose to you, Suleiman Ibrahima, at this point, can journalists be classified as frontline workers?
Well, before then, I just want to quickly say that last week we put out a statement which was some 5 steps to guide journalists as they cope the pandemic. And just to go over them, we have started with highlighting the fact that even before you can do the work, it's important that you as a journalist, you are safe and secure to be able to bring the information to people. And I think that the point about relying on experts has been highlighted. And we need to also recognize that because of the global nature of the situation, there are certain international protocols that every country is trying to adhere to. For example, I've heard so many people talk about why are we not naming names and so on and so forth. I think that there are certain WHO principles that as a country we need to also adhere to, and that sometimes sort of crosses the boundary between what must we do and what must we not do. So relying on the experts is quite something critical. The other point is that we need to break down as journalists the technical terms that we are using. We all keep hearing asymptomatic patients. We hear about isolation. We hear about quarantine. We hear about, vaccines and so on and so forth. The ordinary people on the streets, how would they understand these technical jargons that we use? And as journalists, I think that it's important that we try to break down those terms. The other point that we highlighted was the fact that we need to fight the fake. And I think that one of the issues that have come up quite strongly is the fact that sometimes fake news is even becoming more dangerous than the virus itself. So as journalists, we do have that responsibility, and we put that out quite strongly. The other point is that we need to humanize the story. We live in a society, and we are dealing with different people, different sectors, churches, mosques, pastors, imams, traditional leaders, and so on and so forth. And sometimes our own cultural practices requires that we try and present certain things in one way or the other. So humanizing the story is quite important. And of course, we do know that we have to be ethical at all times. And that was the 5th point that we raised. I'm delighted to hear from Fred that he feels secure and safe. But certainly, given the work that we have to do, whether it is the president, whether it is the ministers, or whether it is the WHO that has to address the people, they still will rely on the media to ensure that information gets out there. And what that means is that constantly we are at the forefront of making sure that whatever messages that the authorities want to communicate, whatever messages that the people want to hear, we are there to present it to them. And that certainly makes us frontline workers. And I've had conversations with people why, in all these conversations so far, apart from exempting journalists from those who have to stay home, or those who have passes to move around, we haven't had conversations at the top level in terms of how are we ensuring that journalists do their work, and there are certain provisions that are made for them, not just by their media organizations, but also as a country to ensure that they do their work, first of all, under safe conditions, but also in conditions that make the work not too complicated and too difficult for them. So yes, absolutely, journalists should be considered as frontline workers in this endeavor.
And having said that, all this while we've been talking and being worried about health professionals who we consider #1 frontline workers. But of course, we've also been thinking of how to protect all of that. How then do we protect the journalists, Ken Ashigbe?
Well, I think it's very important that the safety of journalists is put at the very forefront in terms of what we do. Because you have journalists who would have to go sometime into some of these quarantine centers to be able to bring the news to work. So as managers of media, what other PPEs are we also providing for journalists to be able to go in to bring the story to us? Because sometimes, especially for us in Ghana, people still think that the virus is really far away from us, and we are not able to connect with it. And so it requires journalists to innovate in the way they go and get stories. But for all of this, it means they really need to be at the very forefront, at the place where the virus is. And what protection are we giving to our journalists when they have to get into this space? One of the challenges that we also face as media is that our studios, by their very nature, are very confined spaces. There are spaces where we're circulating the same air in the same space. We use a repeat use of microphones. So it's important for broadcast media to ensure that constantly we're communicating our studios, especially for media houses like yourself, where you're running 24/5. Those studios have to be fumigated on a constant basis. Your microphone flaps and the foams around them and constantly have sanitized. And it's important that periodically you start some of the studios, you have to recycle them so that you reduce time for some of these studios to breathe.
From your assessment, Ken Ashigbe, have we done enough of that? I mean, from all the media houses, have you seen enough of that?
I'm not too sure. I'm not too sure we've done a lot of that. I'm not too sure. Some media houses, you see the rest. You're beginning to see media houses where some media houses are reporting on it. It's interesting that today we're about four panelists using a lot of time, seeing a lot of using technology to bring it in. But I still see reporters who go out to the street and are covering stories, and they don't have long mics at the meeting to be able to cover. And sometimes I see that when the Minister for Information is having his brief, I see the sanitation of the sanitizers on the podium. I don't tend to see the sanitizers when the journalists are asking that. And I also noticed that all of them tend to use the same microphone. I would recommend that we try a way of different using microphones that and are able to take the signal such that it's far from where they are. We need also using his mic. We need to see others.
I think Ken Ashigbe's audio is breaking there. We'll try and fix the audio and bring him back. The audio is giving us a little problem there, so we're finding it difficult to hear what he's saying. But let me bring in Mr. Philmoni quickly in here. We're talking about how to protect journalists. How is the GJA doing that? How is the GJA ensuring that the journalists out there are protected?
This question underlines the need for journalists to internalize safety protocols and reflect them in anything journalistic. We have rolled out a series of workshops for journalists since the outbreak of this pandemic. So as we speak, these workshops are taking place across the country. So we did this all to get journalists to understand the need to be safe, because the nature of our work is that we are exposed to all kinds of dangers and hazards So as we speak, a journalist has died from COVID-19 in Zimbabwe and Togo. So this should serve as warnings, a fountain of lessons from which we should drink as journalists in Ghana.
Well, let me bring you in, Fred. I mean, it's just we've all agreed on the fact that journalists can be classified as frontline workers, and you, to say the least, you've been all over the place searching for information and what have you. What do you want to see from the GJA, for instance, from managers of media houses, from the government, to just be assured that you're protected?
Well, I don't think that the GJA will have to now go around media houses telling them what they should do. I think what they've done so far is enough. People should know that they need to protect themselves, and what you have to do to protect yourself is so clear to everybody. What I see wrong, and the media owners themselves are providing the PPEs, I'm talking about the nose masks and others, the gloves, but people go and wear the mask halfway. So I see a lot of people, or a lot of journalists with a mask on, all right, but they've left their nose open, and it's not only
maybe
journalists.
the education hasn't gone down well then.
Yes, so I find it very difficult to understand. Politicians also wear the mask and leaving their nose, you know, and we've been told that the places where you can easily contract this is through the nose, mouth, your eyes, and the rest. And so once you have the nose mask, it's supposed to cover your nose and your mouth. But some people leave that out. Why do you do that? So you need to take personal responsibility when you're out reporting. When you meet people who are not showing symptoms of the disease but may have the disease, how are you going to be able to differentiate between those people and those who have it?
Part of the things I know, Fred, you've been doing all this while is to also educate the public on some of these things. How do you feel that a lot of people, especially even parliamentarians you talk about, are still not getting how to put on the nose mask? Well,
so you can't run a course for people like that. Okay, so whatever information that the Ghana Health Service is putting out, people must understand. If people can't understand the English language, maybe we will understand that, yeah, the language is a barrier. But there are people who understand the language but are still not following the advice.
So it also brings back the conversation of whether we've educated the rural folks enough. I've not seen much information being translated in various local dialects.
That has been done, Aisha. I'm sure because you're in Accra, I know there is communication. I actually did a documentary on their strategic meetings, how they are planning to roll out this information.
That is being done.
And they've done about 7 different languages. Okay, apart from English and Tree, which I even supported in doing. They've also translated 7 other languages and are playing these on radio stations. They're using, in fact, the Information Services Department is part of the risk communication. NADMO is part of it, and all of them have their own ways of disseminating this information to be sure that everybody in Ghana gets to understand what's going on.
Okay, let me bring in Dr. Amoesi shortly. Doc, how can journalists disseminate information, educate the public? We agree that information is very, very key in containing the COVID-19 pandemic. How do we stay safe out there as journalists?
Thank you very much, Aisha. To stay safe as a journalist, I think there's 2 things that you need to pay attention to. One is yourself, and the other thing is the tools that you use. So for yourself, it's basically everything that has been recommended to the general public. The use of the nose masks, the use of the hand sanitizers, regular washing of hands, and all the other things that we've been taught. And I would really recommend as much as possible for journalists to avoid using public transportation, and as much as possible try and use other means which would reduce the amount of contact that they have with people, because a journalist is moving between, say, Accra and some other part of the country because of their work. And if they are sort of exposed in Accra and are moving to another part of the country that's not exposed, they are putting others at risk as well. So really important to watch that. So beyond yourselves, then there is the tools that you use. And Mr. Shigbe really touched on that beautifully. You think about your phones, your cameras, your traditional pen and paper, of course, your microphones and cables, your stands, your props. these are things that need to be sanitized on a regular basis and treated in such a way that it will reduce the probability that these can become mechanisms of transmission. I watched something really interesting yesterday when I was catching up with the news. A journalist was visiting the ICU in somewhere in the U.S. in the Bronx, and the journalist was actually better clad than the doctor, and the doctor was actually saying, "I wish I had a suit like yours." I think that was really great that the journalist was in a full body suit and really ready to do the job. And it's important that we realize that you journalists realize that you need to have this kind of covering to ensure that not only you are protected, but you don't put others with whom you come into contact with at risk. So really important to watch these.
Let me bring in Ken Ashigbe shortly because we lost you. We lost you briefly. So how do we stay safe as journalists? What do you want to see as journalists go about their duties in these times? We know we are not in normal times.
Well, thank you, Asha. The protocols have been spelled out for all of us. We need to take that into cognizance when we're doing our work. We need to ensure that as we go out and we expose ourselves, when we even get home, the way we take off our clothes, the way we get into the bathroom, all the things that we need to do, the same way that the doctors would handle themselves, that's what journalists are supposed to do. And that's also for when you come to the media houses, business continuity really is going to be important. So I tend to see a bit of that happening in multimedia where now you don't have all your reporters. So if you take the morning show, not all of them are in the studio at the same time. We need to do a lot more of that. We need to also learn to be able to know how we deploy our staff so that, and we've gotten to a point where because you are the front line, the same way doctors periodically will be tested, we need to get to a point where once you get into any space that there's a tendency that anything could have happened to you, it is important for also us to be able to tell journalists as well, so that if it happens, you can catch it quickly and you don't spread it. Because as Doctor said, there's a lot of movement that journalists are doing between dealing with the public officials and then dealing with the masses, going to the hospitals and all of that, and getting in contact with your families as well. So it's at this stage we really need to protect our journalists. We need to give them the right tools that they require. We need to have a lot of disposable material. So I would recommend that now the microphone flaps, we need to get a lot more disposable ones. If it's not disposable, then it should be ones that once somebody uses it, everybody should ideally get his own microphone, so that once somebody uses it, you take that one off and refresh it, you sanitize it before you bring it back. That's really going to be important. It will be critical to see if we can get some extractors in some of the studios that we have, because they're very enclosed and small spaces. How do we ensure that constantly we're fumigating all of those places? We need to also ensure that when we're sending our people, like the example Doug gave, it was a CNN reporter who went into the Bronx hospital. If we have to go into those spaces, and it's important we go into those spaces to bring the stories. We need to be able to tell the stories of people who are recovering, to also encourage everybody. But to be able to get those stories, we need to be able to make sure we are well protected. And at this time as well, for journalists, as Afel said, we need to collaborate. How do we work together? Because we cannot be everywhere at the same time, and all the media houses need to bring the stories out. So how do we collaborate so that we can pull stories together and really be able to tell the story? But we need to always focus that we cannot be martyrs in telling the story. We can't die, we can't get infected if we can do our job as the fourth estate of the realm. So we need to be protecting ourselves. We need to ensure that we are protecting ourselves, and owners of media houses have to have that at the back of our mind. But another difficulty that media houses would face at this time is that definitely once this happens, marketing budgets are going to go down. So media houses are going to suffer. When the government is looking at stimulus packages, they need to also look at the media. How are they going to support? I look back
certainly there is a lot more that media houses have to do to ensure the safety of the journalists. Of course, government has a part to play. The GJA has a part to play, and I'm happy that the president himself, Dr. Afelmani, is with us. And we've also heard the tips that the Media Foundation for West Africa gave and Dr. Amoisi gave to all journalists. We need to take extra precautions because we're not in normal times. I'm grateful that you all joined us. Suleiman Abrahama is Executive Director of Media Foundation for West Africa. Ken Ashigbe is CEO of Ghana Telecommunications and a Chamber of Telecommunications. Dr. Amuisi is with the Infectious Disease Department of KNUST, and he's also with KCCR. And Fred Smith is with our health desk at JoyNews. I'm grateful for your time. My name is Aisha Ibrahim. Many thanks for watching. Enjoy the rest of our programs.